Hi, my name is Brittany Goedde, and I'm going to be doing my assessment, head-to-toe assessment. Here's my badge and picture. This is my blank piece of paper. Also, here's the rubric for me. It's just the blank, nothing written on it. We are in a pediatric treatment room, so there are a couple little IV cards that I can't really take down. If you want pictures, I can take pictures of them. Here is my hand sanitizer I will be using. It will be outside of the video. My lovely patient, and then here is all the equipment that I will be using. Okay. All right. Hello, my name is Brittany. I'm going to be your nurse practitioner student doing a head-to-toe assessment on you today, okay? Is that all right? Yes. All right. So what is your name? CJ. Alrighty. I'm going to go ahead and wash my hands. I'm going to come back over here and do a little bit of a neuro assessment, okay? Okay. I washed my hands. All right, so can you tell me what your date of birth is? 5/9/97. Perfect. And where are we at?
The hospital.
All right, and what brought you in today?
A physical exam.
Perfect. All right, and can you tell me how old you are?
23.
And what year were you born?
97.
Very good. Okay, so I'm going to give you 3 words, and you're going to repeat them back to me. Okay? Fish, one, fire.
Fish, one, fire.
Alrighty. And now I'm going to go through some other things, and I'll come back to those words, okay? So can you tell me what your phone number is?
812-639-7611.
Good. And who's the president?
Trump.
Good. And then can you also count back from 100 by sevens?
100, 93, 86.
Very good. I'll let you stop there. Okay. And then I'm going to have you draw like clock. If you could. With just the 4 numbers. Alright. And can you put it at 2 o'clock for me? Perfect. Thank you. So you can see, here's her clock that she drew. Very good. All right, so what were those 3 words that I...
Fish, one, fire.
Perfect. Good job. All right, so I'm going to go ahead and get some gloves and get your vital signs down. I'm going to put this on your finger. Temperature. Our temporal temperature is 97.7. And I'm going to go ahead and just check your respiratory rate and heart rate as well. So your respiratory rate is 18, your heart rate is 73, and your oxygen on room air is 99%. Now I'm going to get your blood pressure. Blood pressure is 110 or 78. That is a good blood pressure. It is within normal limits for that. Alright, so now what we're going to be doing is I'm going to just kind of start at the head and work my way down. So first, your general appearance whenever I first walked in, your skin is warm, dry, no signs of any rashes, erythema, lesions, masses. You look your stated age. You do not look to be in any acute distress. You look well nourished as well. You're sitting up nice and tall, not slouching over, which is good as well. So now I'm going to kind of just look at your head. You have brown hair. It's well distributed. No signs of any alopecia. Your scalp is slightly dry, but nothing out of the norm. Now I'm just going to kind of palpate for any tenderness, okay? Okay. So hurt at all? No. All right, so no tenderness noted with that. Now I'm going to have you pull your mask down, and I'm going to feel for TMJ, so if you could open your mouth. Good. There's no popping, clicking, so no signs of TMJ. As far as her facial features go, her eyes, nose, mouth, and ears are all symmetrical. No signs of any lesions, masses, discharge with any of those. Her lips are pink and dry. Her ears are evenly distributed. I'm going to just feel if that's okay. Any tenderness with that? Very good. Eyes, so her sclera is white. I'm going to have you look up for me. Her conjunctiva is pink. Okay. All right, if you want to pull your mask back up, you can. I'm just going to do an eye exam now on you. A couple tests. All right. So the first one I'm going to do is just to check your visual acuity. Do you wear any corrective lenses? No. Okay. So this is just a Snellen chart that we're going to be using. So you can cover your left eye for me. Good. And can you read that front to back?
LTFPH.
Good. And then switch eyes and read it backwards.
HPFTL.
Good. And then read with both eyes.
LTFPH.
Good. So with this, your visual acuity was 20 out of 20, and that was checking your cranial nerve number 2. Now I'm going to shine this bright light in your eyes and just see how reactive it is. Okay. So you're going to just look at this back wall, and I'm going to shine the bright light. Good. Perfect. All right. Next, I'm going to pull this pin light, and you're going to follow it with your eyes. Don't move your head. Okay. Good. All right. And then I'm going to move it close to your face. You just follow it with your eyes. Okay. Good. All right. And then next test we're going to do is you're going to look at this pin light, and you're going to look at the back wall, and then back at the pin light. The same thing. Back to the wall, back to the pin light, and then back to the wall. Very good. All right. So next I'm going to just take a look at your eyes with the ophthalmoscope. Okay. So this is going to get a little close. I might get a little close for just a minute to look at your eyeball. Okay. All right. So it's just going to be red light. It's going to look deep into your eyes. Red reflection was noted. Also on the side. Good. So the optic disc and cup were visually noted. Eyes are white, pearly in color. No discharge or anything. Her no papilledemia and no AV. I'll come back to that part. Alright, so next what I'm going to do is we're going to kind of go through your face with different things. So I'm going to look at your ears next, okay? Okay. And do some hearing tests. Okay. But I'm going to look at your ears first. Alright. So her tympanic membrane is gray, pearly, no bulging. We'll take a look at the other eye, or other ear. This one is the same as well. Both canals are patent. She does have a little bit of yellow earwax, but it's nothing out of the norm. Okay. All right. So next, I'm going to go ahead behind you, and we're going to do a couple of hearing tests. Okay. So the first one we're going to do is a whisper test. So I'm going to say 3 words, and you're going to repeat them back to me. But you're going to close your left ear first. Okay. All right. So blue one car. Blue one car. Okay. And switch. 3 dog fire.
3 dog fire.
Good. Very good. So you were able to repeat all those words to me. Next, I'm going to use this, and I'm going to put it behind your ear, and you're going to tell me if you hear it or not. If you hear it, then whenever it stops, you let me know. Okay? Okay, hear it? When it stops, stop. Do you hear that? Yeah. All right. So we're going to do the same thing with the other ear. Okay? Tell me if it stops. Do you hear that? Yeah. All right. And then we're going to do it one more time, and I'm going to put it on your forehead, and you tell me if you hear it in both ears. Okay? Okay. Did you hear it in both ears? Good. Alrighty. So with that, I can tell that her cranial nerve number 8 is intact. Alright, so next I'm going to move on to your nose. I'm going to look at that as well, okay? Then we're going to do some smelling tests. So first I'm going to do the looking at it. I'm just going to look at both your ears. So from this I can see that both nasal passages are patent. There's no signs of any nasal or deviation with it, and no discharge as well. Now what I'm going to do is I have a couple different scents. I'm going to have you smell. This is going to check cranial nerve number 1. Okay, so what you're going to do is shut your eyes, and I'm going to have you close one nostril, and then I'm going to have you smell this. Okay, very good. Shut. Smell that.
Lemon.
Very good. Perfect. Next, what I'm going to do is we're going to kind of move to the next little part. So it's going to be your mouth and facial. First, I'm going to have you make some faces. So if you want to pull your mask down for this part. So first, can you smile for me? And frown. Blow out your cheeks. Good. And raise your eyebrows. Stick out your tongue. Good. Can you wiggle it back and forth? Good. All right. So now I'm going to look at your tongue and your mouth. Say ah. Good. So I can see that your uvula is midline, is patent, no erythema as well, no swelling. Her dental hygiene, everything is intact. There's no signs of any dental caries, no missing teeth. Her pharynx is intact. It's pharynx and both. I'll go back to that part. But there's no erythema and it is visualized. Her buccal mucosa is also pink and intact as well. Alright, so now what I'm going to do is I have a couple of face things I'm going to do, so sensory wise. So we have the sharp and soft. Okay. So I'm gonna have you shut your eyes, and I'm gonna put this in different areas, and you're gonna tell me if you feel sharp or the soft. Okay.
Soft. Sharp. Soft. Soft. Sharp.
Sharp. Okay. And we'll go ahead and do this on your extremities as well because we will be doing that. Okay. So shut your eyes. Sharp. Sharp.
Dull. Sharp.
Yep. Very good. So this is for our sensory part of that as well. The other part is going to be, I'm going to put this cotton ball on your face here. You're just going to tell me if you feel it. You don't have to say what it is. Okay? Shut your eyes.
Yes.
Yep. 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 Very good. All right. So with that, I can tell that your sensation is all intact for it. All right. So if we would like to, I'm going to go ahead and move on to check for your carotids. Okay. You want to pull your mask back up. And palpate. No thrills noted. And it is equal bilaterally. And now I'm going to listen for any breweries noted. Whenever I do this, I'm just going to have you hold your breath, okay? No breweries, bilateral carotids as well. I am going to go ahead back and palpate your frontal sinuses. Any tenderness or anything? Okay. And then your maxillary sinuses as well. Any tenderness there? Okay. And then I'm going to go ahead and palpate your lymph nodes too, okay? So your preauricular lymph nodes, non-palpable, post-auricular lymph nodes, non-palpable, your parotid lymph nodes, non-palpable, your tonsillar lymph nodes, non-palpable, submandibular lymph nodes, non-palpable, submental lymph nodes, non-palpable, your superficial cervical lymph nodes, non-palpable. You could just lean your head to the right. Your deep cervical lymph nodes, deep cervical lymph nodes. Neither of those are those are both non-palpable. Your occipital, non-palpable, and then your posterior cervical, non-palpable. Could you raise your shoulders for me? Okay. So your supraclavicular lymph nodes are also non-palpable. So while we're doing this, I can see that you can raise your shoulders. Can you turn your head to the right for me? And then I'm going to push against you, and you can push against me. Okay? And then same with this. Push against me. Very good. So I can see the cranial nerve number 12 is intact. 11. Cranial nerve number 11 is intact. Okay. Now I'm going to to go ahead and have you lay your head back here. Now I'm going to check for JBD since I listened to your carotids. So with this, I'm going to look with you at 45 degrees with your head. Grab this to measure. Okay, so I'm going to look for PM for your pulse up here. And then I'm going to put this with the clavicular notch. I'm going to measure with my measuring here. And then based off of where the pulse is, it's at 1 centimeter measured to my chart. So that is good. We want it to be less than 3. I'm going to do the same thing on this side. So I've got it lined up with the sternal notch. So I'm looking for the pulse. It is also at 1 centimeter whenever it's measured. So it means there's none noted. Alright. Now moving on, I'm going to move to the cardiac assessment. So I'm going to lay your head back. Okay. What I'm going to do is I'm going to listen to your 4 heart sounds. So if you want to pull your gown down now. Alright, so first I'm just going to listen. Now I'm going to listen with both sides of my stethoscope, okay? Okay. This is my aortic, colonic, my cuspid, and my mitral. And I'm just going to listen to the other side. I'm going to listen to all 4 of the same areas. Very good. And then I'm actually going to have you lay on your left side. I'm going to do the same thing, okay? Okay. I'm going to listen with both sides again. And I'm just gonna listen. Sorry about that. Alright, you can go ahead and lay back on your back. So from what I could tell, there was a normal S1, S2, no murmur, no gallops with that. Also no S3, S4 with that as well. The reason I had you lay on the left side is because sometimes that can bring out that murmur and let you hear it well. Now I'm going to move on and do respiratory. Okay. So first what I'm going to do is I'm going to have you, I'm going to kind of palpate and you're going to say 99, okay?
Okay. So 99, 99, 99, 99.
Very good. So no signs of any abnormalities with that. All right. Now what I'm going to do is I'm going to percuss. Okay. All right. So with that, I heard symphony or resonance. Sorry, resonance with that. Now I'm going to just listen to all of her breath sounds. Let's take some deep breaths. Very good. So I'm going to do this again, and you're going to say E, okay?
E, 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 E.
Very good. So whenever I had you say 99, that meant that there was tactile fermentus, because that's what I heard whenever, or I felt the resonance with that. With this, there is no egophony with that, because I did not hear A whenever through my stethoscope. So that means that there's no consolidation noted. So now I'm going to have you actually sit up. I'm going to do the same thing with your back, right? Okay, so we're going to do just like we did on the front side. So now I'm going to have you say the 99 again.
99, 99, 99,
And now I'm just gonna do this again. Alright, can I hear the resonance again? Alrighty, and now I'm gonna listen to you. Okay, just like we did on the front, so I'm gonna listen to you twice.
Okay.
Big deep breaths. I'll listen to your sides too. Alright, so now I'm gonna have you do the E part again, okay? Where you say E.
E. E. E. E. E. E. E. E.
Very good. So her lung sounds were bilaterally clear in all areas. She also does not appear to be in any distress. Her bilateral lung sounds. I'm going to have you take a deep breath for me. Bilateral lungs are symmetrical. Alrighty. Now, if you want to go ahead and lay back down, I'm going to do an abdomen assessment on you, okay? Okay. Alright, so if we can pull your, we can either pull it up or down. Okay, that's fine. Okay, so what I'm going to do is, based on my assessment, I do not see any signs of a rash, masses, any pulsations, and she is peeing warm, any tenderness. Okay, alright. So what I'm going to do first is I'm going to take a listen because I don't want to make your belly upset. Just like before, I'm going to listen with both sides of my stethoscope. So with that, I heard active vowel sounds, and now I'm going to take a listen for any breweries. Okay. So we'll listen to your aorta. And listen to your renal, iliac, and femoral arteries as well. So there are no breweries noted with this. Now I'm going to go into a palpation and do my percussion again as well, okay? So I'm going to go ahead and just do the percussion. Good. With that, I hear timpani. I'm going to go ahead and do my light palpation now. Any pain with that? Good. So I'm looking for tenderness and any signs of inflammation. So now I'm going to do some deep palpation. So this is just looking for masses. My right lower quadrant, I'm looking at your right ovary, your, your right ovary and appendix. Right upper quadrant, I'm looking at your right kidney. Also looking at your come back to that one. Left upper quadrant, I'm looking at the left kidney tip, and left lower quadrant, I'm looking at the left ovary and bowel as well. With the left upper side, I'm also looking at the spleen, and then that. So there was no signs of any tenderness with the deep palpation. Alright, so now what I'm going to do is I'm going to palpate and kind of percuss for your liver and decide the size of it, okay? So I'm just listening to hear where the sounds change. Alright, if I can have your... Alright, if I can put your finger here. Sorry. There we go. Okay. about 6 centimeters for the liver. Okay. So next I'm going to palpate for your kidneys. Okay. So this is a little bit uncomfortable. What I'm going to have you do is I'm going to put my hand on top and below. You're going to take a big deep breath and then blow out. Okay. And I'm just going to fill in. All right. So I was not able to palpate the kidney on that side, which is normal finding. I'm going to do the same on this side. A little uncomfortable. Okay. Big deep breath. Good. And I was not able to palpate it there as well. Alrighty. So next what I'm going to do, we can actually go ahead and put your gown back on you. While you're laying there, I'm going to go ahead and check your skin and pulses as well. Okay. So you can see that her skin is clean, dry, and intact. It's pink, warm. No signs of any cyanosis, pallor. It's plus 2 with her cap refill as well. I'm going to go ahead and look at her lower extremities too. Hair distribution is even. No signs of edema. Cap refill is plus 2, which is normal. I'm going to go ahead and just check her pulse as well. I'm down here. Checking her PT and her TP as well. Those are both plus 2 bilaterally. I'm going to go ahead and check your radial. There you go. They're even bilaterally plus 2. And brachial. These are also even plus 2. Which is okay. Now what I'm going to do while you're laying here is go ahead and just do some of your active range of motion and your passive range of motion, right? So just to keep you from going back and forth 1,000 times, alrighty? So first what we're going to do is I'm going to have you open and close your hands. Very good. And then can you move your wrist back and forth? Okay. Alright, so now I'm going to go ahead and just do passive range of motion with the rest of your upper extremities. So I'm moving here. Move your wrist. Fingers. Okay. And now I'm going to move you at your shoulder. Sorry. A little close. I'm going to go side to side. Good. Any popping, cracking, pain with that is good. Nope. So no tenderness, no crepitus, no popping, cracking. I'm going to go ahead and do your lower extremity over here. So I'm going to move your ankle. Good. Move your toes. And now I'm going to move at your hip and kind of at your knee. Alright. Any tenderness with that? Good. Now I'm going to do your other side. Alright. So here. Hands. Good. I'm going to move your shoulder. Good. Any tenderness with that? Popping, cracking. Okay. So no tenderness, popping, cracking, crepitus. Now I'm going to do the same thing with your lower. Good job. Perfect. And hit your ankle. And your toes. Very good. Alright. So now if you want to sit up, I'm actually going to let you face this way first, and then we'll turn around the other way. Okay. We're going to do a few things on this side. We will come back to the spine. Okay. So I'm going to have you do your hands. So we're going to do active. Okay. So you can open, close, open your own hands, push against me. Good. And then you can push against my hands. Good. And pull back. Oops. Push up. There you go. All right. And then you pull against me. Good. And push. Perfect. And then put your hands out. Push against. And very good. All right. Now I'm going to return around. Take a look at your spine. Alright, so now I'm going to take a look at your spine. You can look down for me. We're going to do range of motion with spine too. So first, I'm going to check the paraspinous muscles. Any tenderness with this? Nope. Nope. Okay. So no tenderness noted. I'm also going to feel her spine. So this is her cervical spine. Going into her thoracic and lumbar spine. I'm also going to note her C7 and T1 is right here. Alright, can you do me a favor? We're going to do range of motion now. So I'm going to have you look up as far as you can and down. Good. And to the left and right. Okay. And then your head to your ear to your shoulder. Very good. Any pain with that? No. Good. I'm going to tie this for you. Okay. And now I'm going to actually have you lean forward as much as you can. Good. And lean back as far as you can. Okay. And then to the side. And the other side, laterally. Alright, and then can you twist your, yep, very good. So her range of motion, her external and front neck, side to side, is all intact, correct range of motion over age. Alright, I'm going to have you lay back down for a second and have you do range of motion with your legs. Okay, so if you could move this leg for me, you're going to move it at the hip, yep, perfect, and then back down. And then you're going to move your ankle, wiggle your toes, okay? Same thing with the other leg. Good, ankle, wiggle the toes, alright, perfect. And then now I'm going to have you bend this leg, we're going to test strength, okay? Push against me, and push against me, very good. Now I'm going to do this leg, okay? And push, very good. And then now I'm going to have you push like you're pushing a gas pedal, and then pull up towards you, very good. So her strain bilaterally, upper and lower extremity, is 5 out of 5. No signs of any deformities, tenderness as well. Alrighty, now I'm going to test a couple little things. So, can you put your heel up to your knee for me? And then take it down to the bottom. Yep, and then switch. So this is just checking your coordination, okay? Alright. Next, I'm going to check your plantar reflex. So, if you would shut your eyes, or you can keep them open. I'm just going to run this up your toes. Yep. And then this one. Alright, so you can see that that was intact. Her toes did curl downward. Now what I'm going to do is check your greater toe coordination, right? And proprioception. So you're going to shut your eyes. I'm going to move your toe, and you tell me if it's up, down, or in the normal place, okay?
Okay. Up, down, down, up.
Alright. Alright. And then next test I'm going to do, I'm going to put this on your big toe. And then you tell me if you feel it, and you tell me when it stops, okay?
Okay. Yeah, I feel it. It stops.
Okay, can you shut your eye for this one?
Yeah, I feel it. It stopped.
Alright, very good. So I can tell that her proprioception was intact and your sense for vibration. Alright, next, if I could have you sit up, I'm going to do a few other tests with you.
This way?
Face me, please. Alright, so the next test I'm going to do with you is where you're going to take your finger from your nose and then up to mine, okay? There, yep. And I'm going to move and you keep. Good. And then now, if you could switch hands, you're going to do the same thing. Good job. Alright, so next is a fast reflex thing. So you're going to move your hands back and forth. Very good. Good. And now I'm going to do the same thing with your feet, okay? So I'm going to help you out a bit. Alright, as fast as you can. Very good. So those reflexes are intact as well. Let's see. Next, I'm going to have you shut your eyes. So these are going to be, it's going to be a test where I test to see if you can tell what is in your hand, right? So I'm going to put an object in your hand, you're going to tell me what it is. Okay? Oops. A key. Okay? Good. Good job. The next test I'm going to do is going to test to see if you can tell what number I'm drawing in your hand, okay? So you're going to shut your eyes again. 1, okay? 8. Very good. Alright, now while your eyes are shut, can you go ahead and just put your arms out front for me? This is checking for pronator drift. Very good. So your arms are even. No, neither of them is drifting, so you do not have pronator drift. That's very good. Alright, now I'm going to have you stand. This is the Romberg test we're going to do. So I'm going to have you stand with your feet together. It's going to kind of check your balance and coordination as well. So you can shut your eyes for me. I'm going to kind of push you to the side, or just push you out of place, and see how your balance is. But I'm here. Okay, very good. So no signs of anything with that one. Alright, if you want to have a seat for me. Okay. As far as health maintenance goes, have you had your pap smear in the last 3 years? No. Okay, so that is something that I would recommend either having your gynecologist do or your primary care physician and just setting up an appointment just to make sure to test for any cervical cancer risk. That is something that they recommend after you turn the age of 21. Okay? Do you have any questions for me? No? No? Okay. I'm going to wash my hands and look at the rubric and see if I missed anything.